Of course, the question is, once you have that, what are the next steps? Can we actually prevent it, cure it, stop it, keep it from spreading?
Okay, that's a very loaded question. The first thing is case identification. That's why the role of diagnostic is very important. Unfortunately, it's easier said than done. Example, you can enter in the country with no fever, but are already incubating the disease.
Yes.
So even if you pass the fever monitor and you develop the symptoms later on, it beats the purpose of the screening at our ports.
And you would have been a carrier already.
Yeah. But if the person who develops the symptom will not self-report, then that will be a problem because he will be potentially exposing his loved ones.
Yes, yes.
So others would fear of being, stigmatized or for whatever reason are scared of self-reporting, which we should encourage people to do so. It's one way of, in your mind, if you self-report, you are actually protecting your family, your country.
And yourself.
Yeah. And that will also allow for the Department of Health to really be able to do the contact tracing. In fairness to the department, they are really doing their best in this scenario. And this is not the first time they're handling outbreaks. They had SARS, MERS corona, H1N1, and the like. So it's not like it's the first time doing this. But despite of that readiness, if there is no cooperation from the general public on following advisories, then it will they will really have an extremely difficult time doing it. So like in our case, we are not the Department of Health, it's not our mandate to do that. We are scientists, so our role is to develop technologies that hopefully help them address the country's need. And this is one of those things we're
But
doing.
before we go on a break, last question. So, kunyari ako, I come to, I'm tested positive, I self-report. What is the cost of self-reporting? Will I be quarantined for another 2 weeks? Will I be,
Yes.
Why will I self-report apart from the fact that, I don't want my family to get the disease?
Okay. The first thing is, the advantage of self-reporting is when you go there, you will be clinically assessed properly.
Yes.
Whether your general medical conditions requires you to be monitored and quarantined in a hospital-based setting, or whether you can actually be sent home on a home quarantine setting, given the proper advice on how you can stay in your home without potentially infecting everybody else around you.
So hindi naman necessary sabihin na parang once you're found to be positive, when you self-report, you will be stuck here for the next month and a half.
No, it just allows you to do.
Or in a padded
room.
Yeah, kasi yun ang takot ng marami.
That's why that's the power of movies and all of these apocalyptic scenarios and movies that give us this crazy idea.
around you.
But my battle cry is as part of the team in the government in addressing these problems. We are the research side, which we really need to exert all our efforts from all sectors in society to help the Department of Health. They can't do it all by themselves. They really need some help from the private sector, lalo na ang private sector or lalo na yung individual who are traveling or has a history of exposure from those who have been exposed to the disease. And without that cooperation, it's going to be a major challenge.